Hello, everyone. I'm Rachel Anderson, Corporate Director of Supply Chain for Baptist Health in Central Alabama, and I'm a member of the Future Famers Class of 2023-2024 Advisory Council member and Chair of the Professional Development Committee for the Bellwether League Foundation. 2 years ago, the Bellwether League Foundation launched its Collegiate Capstone project. This allows students and faculty from universities and colleges with supply chain programs an opportunity to research issues that are affecting the industry and provide recommended solutions, all while achieving grants for their awards and efforts. So far, we have featured several projects each year during our Bellwether Leadership Symposium in October. The first project that we featured was in 2022 from the University of Michigan, in 2023 from the University of Arkansas, and the 2024 project was for the University of Wisconsin-Milwaukee. I'd like to welcome you to watch a presentation from our fourth Collegiate Capstone project from graduate student Jared Pavlik, who's pursuing a master's degree in industrial operations engineering from the University of Michigan. Jared and his team worked with the Center for Healthcare Engineering and Patient Safety at the University of Michigan in conjunction with Michigan Medicine, where they conducted a clinical ethnography of the pharmaceutical supply chain within a major academic medical center. The goals were to develop knowledge about the supply chain within a major healthcare system, as well as the complexities of supply chain in a clinical environment with a concentration on pharmacy. If you're a student or professional interested in hearing more about the Collegiate Capstone program, stay tuned after the presentation for more information.
Hello, my name is Jared Pavlik, and I am a master's student in industrial and operations engineering at the University of Michigan. I am doing this degree as a 5-year program. I did my undergraduate degree here at the University of Michigan in biomedical engineering. And with that, I have also been an employee with the Center for Healthcare Engineering and Patient Safety. So this is a program I got into at the end of my undergrad during my senior year when Amy Cohn came as a guest lecturer to one of my courses, and I heard about this awesome opportunity to work in healthcare operations, try and improve kind of the supply chain, the scheduling, the workflows that we're seeing here at Michigan Medicine, and try and kind of do some research that might be applicable to other academic institutions as well. So since joining this program, I have been blessed to work on many different projects. More recently, as my role as a graduate student research assistant, I was able to work on a project with Mark Van Sumeren, Amy Cohn, Allie Haskell, and Robin Jones-Bellamy on understanding kind of what's going on at the Michigan Medicine Pharmacy. We did this because we knew that the pharmacy at any medical institution is kind of the backbone of what goes on, whether you're in an intensive care unit or a surgical suite or an inpatient or really just a quick check-in. Having a strong pharmacy that interacts with all these different sectors of the medical system is super important and will be important for all the projects that we do in the future. So the goal of this project was to just get into the pharmacy, really understand what goes on, where's the flow of the money, the flow of the people, the time chunks, what are things that are dated, what are things that are new, what's happening in this process. And then as we learn and document what's going on with this process, we might be able to find some low-hanging fruit. Where are some areas that we can kind of drive some opportunity and improve the Michigan Medicine pharmacy system? Also, while we were doing this, one of the goals was to really just map out and understanding the ins and outs. What are the inputs? What are the processes within the pharmacy? And then what are the outputs that they have at this pharmacy? Through this, we hope to help improve our future projects at CHEPS and in general at Michigan Medicine, allowing more and more teams to understand how their projects might impact the pharmacy and how these different data flows might impact kind of what goes on throughout Michigan Medicine. We did this because we were inspired by seeing so many projects that we do kind of run into a hiccup at the last mile. We thought we had something great implemented, stuff was going well, but then you learn just at that last second that, oh, this niche policy that goes on in pharmacy completely changes that new policy and this great implementation plan we had with an emergency department thing that we were hoping to implement in all these different projects. When we run into these small hiccups, it can really, hurt the team and hurt some of our implementation and improvement steps. So trying to understand what's happening in this department will help all of our future projects. So in this podcast, I'm going to talk a little bit about kind of the progress we made, the steps we took, and then some of the findings that we had throughout this project. So with this project, the first thing that we did to really try and understand what's going on in Michigan medicine pharmacy was getting into the pharmacy. We wanted to see a layout of what's going on in the pharmacy, who's working on what, how are the drugs spatially distributed, what's the flow of drugs throughout the pharmacy, are there specific areas that are more regulated or require more vented hoods in order to conduct the pharmacy work. So with this, we were given a lot of great opportunities from Michigan medicine leadership because they had buy-in too. They wanted to understand what's going on in the pharmacy themselves, and they wanted to hear some ways they could improve the pharmacy. So once we got into the pharmacy, our team realized that a pharmacy today is cramped. There are a lot of drugs going on in any pharmacy around the country. And this was not a huge shock to me. I've worked at a couple other medical institutions where I've seen and I've heard that all these new drugs that are coming out, these gene therapies, these one-use drugs, all these different niche drugs that have scaled exponentially in recent years, as we're able to cure and treat these much more developed, more niche illnesses that we weren't able to before, we are starting to run out of space in these larger institutions that were built in the 1900s that weren't necessarily anticipating all these different specific medicines that we now have today. So with that, we're seeing carts packed in the hallway, tight walking spaces, and really every space utilized possible in order to hold these newer medications that we did not have space for before. With that came the pharmaceutical carousel, something that I thought was super cool and did not expect at all. These machines were something that automatically brought the medication that was requested all the way upstairs to the pharmacist in the pharmacy, said they can deliver the medication easily, quickly, and have a ton of visual cues to allow them to do this. These are huge rectangular sections within the pharmacy that spin carts all the way around in a circle, and so that the medication that is desired is delivered directly to the pharmacist at the time it's requested, and easily allows for barcode scanning to track the quantity that's held in each of these bins, and also allow for it to easily get to the consumer. Other things that we noticed in terms of space optimization and issues with that was that there is still a lot of areas that are used for COVID-related backorder surpluses and COVID-related policies that is something that's probably going to be slowly phased out as we finish 2024, and hopefully by 2025, all of these areas are gone and converted to more conventional and more current medical concerns. However, this was a huge issue and something that was very noticeable as these surpluses took up large quantities of space in areas that are so vital to having good space optimization and use cases in these pharmacy departments as they're filled with more and more drugs. Once our team had an understanding and a lay of the land of what's going on in the pharmacy, we were to look a little bit more into what's going on in the data and information flow sides of what's happening in the pharmacy. Although it was a little cramped in there, we found that we were very impressed by how well the data is maneuvered, how information flows, and how people can get their work done in the pharmacy to make sure that the medications that the patients need can get there quickly, effectively, and safely. The way this process works is when a doctor files for a medication in Epic, the information is quickly shot down to a team of pharmacists who work right next to the pharmacy floor, and are able to look at all the different medications that a patient is on, review if this medication will be safe if added to the patient's medical routine, and then can approve that for being sent up to the patient. With this process, the carousel then comes into play. The carousel brings the medication to the pharmacist to grab, or in other more serious cases where the medication might be a little more controlled, the pharmacist will enter these more controlled rooms and gather up the medications that are needed for the patient. From there, the team quickly brings this up to a front counter where the medications are counted, assorted into bags, and then transported up to the patient as quickly as needed based on how the doctor had requested for the medication. Now, that is if the medication is coming from the central pharmacy. In addition to that, there are many different things called Pyxis systems that are located on many of the different hospital floors within Michigan medicine. These systems are systems that are implemented in hospitals around the US and even around the world that allow for doctors and nurses to have quick access to medication while still offering a layer of security to make sure that proper counts of medications as well as proper dosages of medications are appropriately received. These machines are placed on each floor and close enough to the patients that you can quickly grab these medications as needed. To do this, a medical professional will log into the Pyxis machine, select the specific medication on this rectangular machine in which they would like, and then the exact drawer that that medication is on will slide out towards the provider. The specific drawer in which this medication is held in will pop up, and then dependent on the regulations for that medication, the doctor or provider will have to either count how many tablets are left in the machine or provide a number of medications that are needed for the patient to make sure there's an accountability and security associated with these drugs and the transfer of them to make sure that the patient is safely cared for and that drugs are accounted for correctly here at the institution. Now, having these two different areas where we're able to gather medication allows for really two major benefits. One, it allows for security and central storage of some of the more niche medications at the central pharmacy. That bulk storage, having the more specific medications down there, makes it so that you don't need these huge rooms on each and every floor of the pharmacy. While also on the other end, with these Pyxis systems, you're able to have a quick, easy way to get a lot of the more regular medications directly to the patients without having to walk all the way down, without needing a huge chain of communications, and without needing for a large team to get these medications to the patient. Having this two-factor system has been a really effective way to reduce the amount of communication needed, as well as optimizing the way that we get medication to different patients. With an understanding already of what's going on both physically and with information within Michigan medicine pharmacy, our team then wanted to understand what are the different policies that people in our pharmacy leadership have to follow in order to stay within federal and state rules and while making sure that patients can receive high quality care. To do this, we asked some of the members of the pharmacy leadership team to provide us with some of the specific details of what's new in policy and what's been something that's stayed for a while in the policy that impacts the workflows that happens in Michigan medicine pharmacy systems. With this, we found that the main governing body of this is USP. More specifically, USP Chapter 795 on pharmaceutical compounding for non-stale preparations, Chapter 797 on pharmaceutical compounding for stale preparations, and then Chapter 800 for hazardous drugs and handling them within a healthcare setting. Between these three different chapters, the whole pharmacy system has to follow a large subset of rules that helps to guide kind of what our pharmacists can and can't do to make sure that our patients are cared for properly. Now, one thing that comes about with these chapters is that they do sometimes change over time. We found that early in 2024, some different regulations changed requiring different gaining and holding of hazardous drug materials, as well as the handling of them as they're being compounded. Things like this can impact the investments needed for different ventilation systems within the pharmacy, different hood systems for handling, as well as the PPE that people within the pharmacy are required to wear to make sure that the people in the pharmacy are safe too when handling these specific drugs. These policies allow us to make sure that we can get the drugs safely to patients and that our people working in the pharmacy can be safely treated and that they're not going to have long-term impacts on them for work in these settings for long periods of time. That being said, as we mentioned earlier, there are already space constraints within a lot of these pharmacies. Pharmacies that were built in the mid-1900s don't necessarily have the ability to expand, especially since a lot of pharmacies are built within the basements of hospitals when there was no real intent on need for expanding these pharmacies because there were less drugs at the time. As these new regulations come about and are updated to make it so it's a safer process for people, it is a burden and a hurdle for all of these healthcare institutions to invest in these new opportunities, to have to prepare for it, and then find space where they're able to add this new ventilation, where they're able to add these new safety precautions, where they're able to add these new different cabinets that are required for these specific drugs. That being said, it is still very important that we focus on the health of the people that we have working in our pharmacy and the patients that we have. So these regulations are necessary and are required, but understanding the impacts that these regulations can have on specific companies, the employees, and the burden they're already receiving is very important for our policymakers as we consider how these different chapters can impact the workflows that they have. Although I don't want to bore you with a conversation about healthcare economics and how we fund these different pharmaceutical endeavors, this conversation would be missing out on something if I didn't bring up this new era of pharmacy systems that we're entering in, as we enter in this era of more niche, more expensive, and more specialized care for patients with these more niche diseases. Just an example, in March of 2024, the U.S. Federal Drug Administration approved for lenalidomide, a $4.25 million drug. That is a one-time drug treatment that a couple of patients around the U.S. will be requiring each and every year. As we get more niche and niche drugs within our system, there will be more and more filled pharmacy systems as these niche drugs to have very limited quantities within the pharmacy. However, there's so many of them to care for all these different ailments that are occurring. Now, with that change in space capacity also comes a huge economic shift as insurers, healthcare systems, and patients often consider who's going to pay for this $4.25 million drug. And then how is kind of the profit going to be distributed amongst the system? This has a huge impact and will be something of huge debate as policy comes forward from the FDA and from policymakers that determine how do we regulate these different types of drugs and how do we make sure that these drugs can be given to the patients as needed while providing the profit for the healthcare systems and for the drug providers. This is a very interesting and unique problem that we'll be coming up to in the near future and something that we need to consider as we change what we're doing within pharmacy systems. All changes from here on out with the supply chain, with how we manage internally, and how pharmacies are overall ran, we'll have to consider these new advances in these more niche drugs that cost a pretty penny to develop to get to the patient. And is something that will be on the forefront of all minds moving forward within pharmacy systems.
Now, those were some of the key learnings we had throughout this project. I'm now going to talk about some of the bigger recommendations and conclusions that we had for this project, the ones that aren't exactly niche to Michigan medicine, but more so the learnings and conclusions we had that could be applied to other healthcare institutions, or really any other industry, as long as they have some of the similar principles that we have here at Michigan Medicine and within our pharmacy. So the first of those recommendations and conclusions is the need to improve forecasting, especially when you have a large quantity of SKUs, to improve your ability to understand space allocation, technology investments, and space investments. If each pharmacy has better understanding of when specific drugs are needed, how much of each drug is needed, and specifically allocates that space properly, a lot of these different space requirements and needs that we're running into issues with right now can be improved. And then you actually understand much better when you need to invest that money on improving and expanding your space or investing in these new things like these Pyxis systems. So improving your forecasting and understanding what you need is vitally crucial. The second recommendation, and something that really needs to be done everywhere whenever any operations work is done, is making sure that you talk to the experts when you make change. In this case, that would be talking to the nurses, the doctors, the pharmacists, the people who are actually working on these floors whenever you're trying to make specific changes with these drugs or these pharmaceutical operations. For example, this might be if you're changing the Pyxis system needs to better allocate what is needed for each floor with the drug distribution. Making sure that you talk to the nurses, the doctors, and the pharmacists will make sure that all those small problems that you don't think of as an operational person are actually understood and well documented before you implement these changes, so that no hiccups are brought up when the actual implementation occurs. The third and final recommendation I have for pharmacies across the US is to apply some, and I know this is probably pretty normal coming from an operations person, but try to apply and integrate some sort of Six Sigma lean operational team within the pharmacy operation so that a team can go in, work on projects that are targeted at improving the time and space allocations to really improve the efficiencies of what's going on in these pharmaceutical teams. For years, most of the pharmacy has focused specifically on just getting the drug to the patient without much understanding or need to understand the space allocations and the constraints that come with these things. Now that we're running into these tighter space constraints, higher financial burdens, and more issues, it becomes more imperative that greater investments are made into improving the understanding and the operational efficiencies that are going on within these pharmaceutical areas.
To conclude, I'd like to thank Mark Van Sumeren and the Bellwether team for allowing me to do this podcast and share with you some of the things that we found throughout our deep dive of Michigan Medicine Pharmacy. This was a big project, and we weren't able to share all of our long documentation that we have of what we learned last semester here, but I hope giving a little bit of a taste about some of the future space constraints, financial constraints, policy constraints, and information flow constraints that we might see as a global healthcare supply chain, specifically with the pharmacy in the near future, might inspire people and helps them see kind of what trends we can expect here as the pharmacy enters a new era with more specialized medicines and how we try to implement these things in kind of more dated pharmacy areas. This is a problem that's going to be faced all around the United States and is not something that's unique to Michigan medicine. These are trends that we'll see and that will impact everyone. I would also like to do a huge thank you to the Center for Healthcare Engineering and Patient Safety here at the University of Michigan. The CHEPS program is an amazing initiative that allows students to get involved in healthcare system questions at Michigan Medicine, allows students to have real impact and apply their research in a meaningful manner. I highly recommend anyone reach out to the Center for Healthcare Engineering and Patient Safety, as this program has had a huge impact on many students and patients on applying healthcare here at Michigan Medicine. Thank you very much for this opportunity. Goodbye.
I'd like to thank Jared Pavlik for his Collegiate Capstone project presentation. If you'd like to learn more and find out how to support the program, please go to thebellwetherleague.org. There you can click on the philanthropy button, where you'll be able to find information about the application, as well as the guidelines and the 3 new scholarships that we have supported by the Bellwether League Foundation this year. Thank you.